not going to spend a lot of time talking about the provisions that have already been adopted and by public health. The first dollar coverage of critical preventive services, I think those are already on the radar. Expansions of childhood health insurance program and obesity demonstrations. The National Prevention and Health Promotion Council and the National Prevention and Health Promotion Strategy, all those are things that I'm sure you're looking towards. There's some workforce provisions under the Affordable Care Act, which, assuming, we have to be very careful they don't get cut out, which have an impact on the public health workforce. Loan repayment, training for mid-career public health workers, epidemiology-led capacity grants, eliminating the cap on the commission core, and grants for community health workers. All of these are issues. So I won't spend a lot of time to say that this is, but obviously the Affordable Care Act will have a major impact upon what's being done in public health. So I'm going to go to my last point and talk about the budget cuts. We know that almost every state in the nation, save 4, are facing critical budget problems. And that's sort of telling this to those of you who know that very well, because it's not only affecting local health agencies and state agencies, but it's also affecting institutions such as universities that are state funded. Well, this kind of brings me back to where I started. As you can see, this is a map of annual percentage change in the GDP, and I'm going to go back to where that arrow was, which is when I first started as a state health officer in 1991. The budget was so bad, Governor Edgar was just coming in Illinois, that we were doing budgets every 6 months, and we weren't making them bigger each time either. We were doing the kinds of cuts. So one of the first cuts that we had, and a new state health officer, I'm kind of deer in the headlight. There was somebody in the governor's office, and as you know, there always is somebody like this in the governor's office, who didn't think that planning was really something that you should be doing. So any unit in any of the state agencies that had planning in their title was going to get cut 50%. So we had this unit, Policy and Planning, the Office of Policy and Planning, which included the Certificate of Need program. That's where the planning came from. Also included the Cancer Registry and Adverse Pregnancy Outcome Registry. So I was pretty clever. I said, well, we're just going to change the name of the unit. And we called it Epidemiology and Health Systems Development. And we figured if we called it epidemiology, the 22-year-old sitting in the budget office would have no clue what that was, and so they might be afraid of cutting it. That actually worked. But that year they were also doing a reduction, and this was something the state of Illinois used to have a public health news back in the 20s. And they had a great series of cartoons, and this is about the importance of having a local health department. But they also wanted to have a reduction in a program called the Basic Health Services Grant. What the Basic Health Services Grant was a $12 million fund that was unrestricted support to local health departments. And they would use it for things like sex education and HIV prevention. They would use it for immunization programs. They would use it for vector control. All good public health purposes. Now, how do you go before a legislative committee and tell them that this $12 million is being used wisely by each local health department when they all use it differently? Okay, what do we get for that $12 million? Well, over in Peoria, you get this program that does prevention for heart disease, and then down here you get, that doesn't go very far. So what we did is that we decided to change this. First of all, I kind of got into this name change, Basic Health Services Grant. What's that? So we called it the Local Health Protection Grant. Health protection, that got about half of the budget folks said, oh, can't touch that. But then we began to look at it and we said, let's look at services that are already being provided by local health departments, because Illinois has a certification program that's been in place for decades. And there were 10 required programs. So we said, let's tie in this, and then we can use measurements of service. For instance, restaurant inspections. How many restaurant inspections? And we could tie in the number of restaurant inspections that were being supported by the local health protection grant. We could tie in how many water wells were being inspected and how many private sewage installations were being inspected based upon funding from this grant. And we also tied it in to infectious disease, control of infectious disease. And this is a DNA fingerprinting of an outbreak. It was the first one we did with the molecular biology lab in Illinois, and that's a longer story than I'll go into. All of this was geared towards trying to use measurement and evidence and link that into the budgetary process. In this time of budget cuts, more than ever, local and state health departments need your help to be able to make the arguments, to make the case. Using this approach, we were able to fend off not only the budget cuts in 2000 and in 1991, but subsequent budget cuts. And in fact, I just checked the state of Illinois budget, which is a draconian budget. But the local health protection grant is one of the few line items that was uncut in the current 2011 budget, or for fiscal year 2012. I was always struck. Senator Rauschenberger was head of my appropriation committee for a number of years. And it didn't come home to me until I was at a party. And he introduced me to someone. He said, "This is Lumpkin, he's my friend. He always comes to our appropriation committee. He makes a lot of sense. We just never give him any money." And that really is the challenge, and how we make those arguments. Accreditation will help make those arguments, because they can understand that there is a national standard that each health department can be held for. Having valid research on the impact and return on investment. Public health services and systems research helps us to learn what works and provides the evidence to support policy. Because at the end of the day, public health is so critical to our lives and the lives of everyone living in this country, in every state, in every community. Franklin Delano Roosevelt knew the right of it when he said the success and failure of any government in the final analysis must be measured by the well-being of its citizens. Nothing can be more important to a state than its public health. The state's paramount concern should be the health of its people. And public health systems and services research gives us the science base to move that forward. Thank you.